I don't know why the stigma is still a thing. I'm not sure where the stigma came from, but the idea that medication to help any type of mental illness, anxiety, depression, anything they say, like society thinks is smaller, should not be treated with medication and should only be treated by seeing a therapist. Honestly, initially I did kind of agree with that, and I still hate taking my medication. I think it's a mix of the stigma that still surrounds it, and unfortunately I'm a part of that too, but I'm really trying to work through it. I've been taking medication for, I don't know, 5 years now. So while I'm trying to stop this stigma for myself in my own head, I think we should take this video and all educate ourselves and be more patient with people and the reasoning behind why they may be taking medication, and certain therapy techniques outside of medication doesn't fully help, and you'll need both the balance in your brain and the actual application of therapy sessions. I mean, my dog here takes medication for her anxiety as well. Whether you believe dogs have anxiety or not, the vet prescribed something similar, obviously a way lower dose for her, and she's been doing a lot better. The confidence is there. We have been training her to expose her, kind of just like what therapists do with people. Essentially learning how to live in the real world and cope, but with a little bit of help. So why does the stigma still exist, and why does someone like me, who have been taking medications for my anxiety and depression, still feel this stigma today? And why I'm still super hesitant to take my medication, see a psychiatrist, even though I'm doing that every single day. I just remember during my second year, I was talking to my parents about how I've been seeing a therapist and finally letting them know that I am experiencing a lot of anxiety and I've been depressed for no reason for a while now. And thanks to my husband pushing me, not forcing me, but pushing me into going to see someone, and it was free at school anyways, I was lucky enough to have been matched up with such a great psychologist and work from there. But thinking back and seeing how my parents kind of reacted, especially my mom at the time, reacted to me taking medications to help deal with the depression and anxiety, she was like basically crying, and I'm not really sure why. I mean, I kind of understand that, like, oh, your kid is sick, I guess, or going through some kind of mental issues and she needs medication to deal with it is kind of scary for her, or scary for Asian parents in general, or maybe even parents in general, and the education around mental illness and the stigma around it is not very good. But I remember that she was basically crying and didn't want to show me her sadness, and took a few days, even up to a week, to figure out if I should take it or not. They were begging me not to take it, especially my mom, and I understood where they were coming from, and I kind of started to feel like they think I'm some different person because I want to take medication to help with whatever's going on in my head. But that's not really the case, and I know she just cared and loved me a lot. But I ended up continuing with the medication and took it because my psychologist actually referred me out to a psychiatrist at the university, and I was able to see how the coping mechanisms or techniques that my psychologist was giving me, see how that can be implemented. Honestly, after starting medication, it was outside all the side effects for about a month or so. You could really feel the difference, and it really did help me understand how to use the coping mechanisms that were given to me. The reason people take medication is because obviously there's an imbalance possibly in the brain, but often people are referred to psychiatrists when the psychologist thinks that there needs to be a little bit more to be done. You're not necessarily going to be in a loop of medication forever from what they tell me. I'm not an expert, obviously. I'm just talking about my experience. They say like you stay on it for a year or so and then you can kind of slowly wean off if you don't need it. But unfortunately, I needed it, and there was something in my brain that was different. I could not just do CBT and kind of work through all my issues from my second year or from my past in general. So the medications actually helped, and it's helping me to this day. And I was always nervous telling people like, oh, I'm on medication. Sometimes people just automatically ask like, for what? And sometimes it's way better now. Like, I think the education and the awareness behind everything has been a lot better, but I still hate the idea of taking medication, and I think that was shaped by how I was grown up or how I was taught to see that mental illness is not a thing, I guess, for some reason, the Asian culture, or you ignore it, or you push it down, or you learn from it and just deal with it, or put your head down and study your butt off and get through it. But mental illness is a thing no matter what, and I want to talk about education and talk about medication and seeing a psychologist and psychiatrist throughout this week, since it is Mental Health Week. If anyone in my family is watching this and, you know, you're the parent, like if you're my aunt or uncle or something, I would encourage you to look into medications and psychology and all of that more, because yeah, your children might seem fine on the outside, or your children are probably going through some trauma that, you know, just kind of happened as they were growing up. You don't really know why, and honestly, everyone could see a therapist and benefit from seeing a therapist if you can afford it. I just wanted to say, like, just because I'm taking medication, no matter what I believe and what I'm working through, that doesn't make me any different. I do have some imbalances in my brain, and I've had episodes and issues and career path issues because of it, and it has been difficult in the sense that, like, the world externally, like outside of my brain, really affected or triggers this that much. I mean, obviously, when something traumatic happens to you in your life, whether it be a car accident, a death, that could exacerbate the anxiety and depression, obviously, and then it'll explode. And if you keep it in and you're not treating it properly, then it just gets worse and worse. Personally, this is kind of hard for me to talk about, just because I've either hid that I'm taking medication for my brain from a lot of people, or people who do know were not everyone. A lot of people were supportive, and my parents did grow to accept that this is what it is, and it's helping me, and that if it's helping me, then it's good. But a lot of people, whether it was where I was working, at school, some friends, they kind of possibly looked at me differently, and I wasn't overreacting to that because they were verbal about it. Whether I should go more natural, like the more natural route. A lot of my medication is more focused towards anxiety and trying to figure that out and cope with that, because, man, sometimes my brain just, like, it's just like this circle, like it's always thinking and thinking, like the smallest thing. I think my biggest issue with the stigma is that because I pushed through the stigma and I'm consistent with my medication as best as I can right now, I'm actually living life even with the pandemic that's happening. I'm on YouTube here. I'm trying to put myself out there on social media. I just want to have a voice in the world and somehow change someone's life. I don't care who or how many people. This Mental Health Week and the awareness I can try to bring to even just my own story I'm not saying this is the same for everyone, or like it's not, probably. Like, I'm not an expert in psychology or anything. I took 2 psychology courses. They were 100 level in university, so I am not an expert. But me trying to talk about how, especially if you're like an aunt or uncle or someone who's an adult with children who know me personally and have seen what I have possibly gone through, or if you see that I don't look like I have gone through anything, that you should check in with your kids and see if they're okay. Like, I mean this. Mental illness is a real thing, whether we like it or not. And just because we're Asian doesn't mean it's not there. And just because we close ourselves off from it doesn't mean it's not there. It makes it worse. So if you're a kid and, like, if they're my friend or my cousin and you're not addressing it or asking them about it or trying to figure out if they're okay, and you're not asking them if they need to see someone who can possibly refer them off to, if they do need medication, whatever it might be, then you're part of the problem. I know I'm a part of the problem because I always, not really fight with my husband, but he always wants to make sure I am taking my medication on time, and if I ever have refills or if I miss an appointment with my psychiatrist, that I book it right away, even though I hate it. I still push it down, and it's not good, and it's been like 5 years of this. So don't pretend your kids are all good, because whether it's, you know, barely anything or severe, it's good to address it as soon as you can and talk to them about it, because mental illness shouldn't be a problem, and we should talk about it. And that's kind of what I want, is for everyone to talk more and educate themselves, because you never know when it's too late. You don't want to, you know, have a bad relationship with your child or family member or friend if it is severe and they, you know, there's some imbalance in the brain, and it can lead to suicidal thoughts, and that's scary, right? Like, that's sad. So address it now, figure it out, stop creating like a huge negative stigma around medications or mental illness, and get checked out. Talk to someone, talk to a therapist, and figure out what you need in order to actually live life and try new things. Because without medication, I wouldn't be on YouTube right now. Without medication, I wouldn't be living in my own home with my husband right now. Without medication, I wouldn't be able to take care of my dog properly. Without medication, I wouldn't be able to have started this company or had the courage to. And without medication, I would not be dealing with grief very well. So stop stigmatizing it, because people need it, and medication has helped me and my dog get through what I need to get through and live.